Hello, I'm Dr. Seth Riafi, and in this session, I'll give you an overview of the US healthcare system and future directions of healthcare. I hope that you can see where public health can fit to improve healthcare for our citizens and residents. In the past, public health professionals have worked in local health departments, while healthcare professionals have worked in hospitals. Over the past decade, that has changed. Nowadays, public health is now working in healthcare organizations, and healthcare workers can be found in community settings outside of a hospital. But has this actually helped to improve the health of the US population? I hope that this presentation, together with the assigned readings, will give you a better understanding of where things stand now and how to move forward. I want to give you a little background before we talk about this slide. OECD stands for the Organization of Economic Cooperation and Development, and it consists of over 30 democratic governments across the globe. OECD member countries represent 63% of the world's gross domestic product, GDP, 75% of world trade, 95% of the world's official development assistance, over half of the world's energy consumption, but only 18% of the world's population. So the countries represented in OECD hold a lot of economic power, but represent less than 1/5 of the world's population. Now back to this graphic on the slide. According to the OECD, the US spends more money per capita on healthcare than other countries. You can see this trend from the top red line, which represents the US. The OECD average healthcare expenditure per person was $3,300, while the US spent over $8,500 per person on healthcare. That's 2.5 times the amount compared to other developed countries. So, if the US spends this much money on healthcare, are Americans healthier? Do they live longer? Well, let's find out. The gross domestic product, or GDP, is a barometer of a country's economic health. Still looking at healthcare spending as percentage of the GDP, the US again spends more money on healthcare, almost 16% compared to other countries. Keep this in mind as we look at the next slide. We've just seen data that shows that US spends more money on healthcare, both per capita and percentage of its GDP. Now, let's look at rankings and outcomes for healthcare. Most people assume that because the US has such an advanced healthcare system, that we surely have the best healthcare ranking and outcomes. However, this slide will tell you a different story. The countries are listed at the top of the table with their flags in alphabetical order. The US is on the far right. For color coding, dark blue is the top tier. Light blue is average, and white is the bottom tier for ranking. This chart is based on 2013 data from the Commonwealth Fund. Compared to other developed countries, the US does not rank in the top tier of any of the outcomes listed, and we come out dead last in efficiency, equity, healthy lives, and overall rankings. What this means is that we are spending a lot of money and getting poor results. If the US healthcare system was a business, it would be bankrupt. If you look at the column to the left of the US, I think we have some lessons to learn from the UK based on rankings and expenditures. What do you think? More data from the Commonwealth Fund shows on the left that the US does a poor job at delivering affordable healthcare to those who cannot afford to pay for it. Only the UK does better than any other country listed. The US also has a very inefficient system of time spent on paperwork compared to the UK. So, to summarize what we've seen from these 4 slides of data, the US spends more money on its healthcare, has some of the worst rankings, and does not deliver affordable, efficient care to poor people. But how can this system be improved? We will spend some time talking about how we can make healthcare better in the US. Here are some of the trends in healthcare that I want to share with you. In the US, a brief history of healthcare is given, which has been a combination of both private and government healthcare funding. In the 1960s, the role of national healthcare expanded with the introduction of Medicare, also known as healthcare for the elderly, and Medicaid, called Medical in California, which is healthcare for the poor. It wasn't until 45 years later that any significant policy changes were made to the national healthcare. This occurred in 2010 when President Obama signed the act, the Patient Protection and Affordable Care Act, or ACA, into law. Since 2010, political uncertainty has become evident in the recent elections and proposed repeal of the ACA. In addition, money spent on health research has increased, although this has not translated into improved health outcomes. Other trends in healthcare in the US include a shift to outpatient care rather than lengthy hospital stays. Reasons for this shift include reduced costs and improved patient outcomes, such as less nosocomial infections and faster healing times. However, this leaves an excess of hospital beds in the US. With increased cost of healthcare, primary care and prevention have been recognized as deficient or lacking, not only in services provided, but also in funding. Most healthcare organizations have specialists who care for patients with specific diseases, such as internal medicine physicians treating diabetic patients. However, this shift over time is a result of reimbursement from insurance, both private and government, based on diagnostic codes. This translates to fewer physicians who actually perform primary care due to the lack of funding for these generalist positions. Physicians and other healthcare workers reside in larger metropolitan areas, which means that the rural areas with lower socioeconomic status have less healthcare resources. This leads to a lack of access to basic healthcare services in this area. More trends in the US healthcare include growth in technology, shift in healthcare ownership, changes in healthcare regulations such as quality, patient safety, and reimbursement. Managed care has taken over healthcare, which means that the patient's healthcare is controlled and follows a standardized plan of care, reducing length of stay and requiring oversight and approval of diagnostic services for patients. Outpatient, ambulatory, and retail centers have shifted healthcare away from hospitals to other areas. One example is the growth of dialysis centers away from hospitals and healthcare organizations out into the community, such as retail areas. Using technology to diagnose and treat patients, particularly in rural settings, through mobile or mHealth, and making a patient healthcare record electronic and accessible to other healthcare practitioners. It is now rare that a patient hand carries copies of their medical record or imaging films to their appointments. eHealth includes electronic medical records and is incorporated with their patient's health data, which now creates large data sets. The future of healthcare includes analyzing big data to determine trends and needs for the future. That's better known as population health, and public health plays a huge role in helping organizations to plan for the future of their patient population, particularly for preventive services. I hope that this has helped you see through the US healthcare system. And then you can also articulate that healthcare in the US is changing and continues to evolve around reducing costs and improving outcomes. Public health professionals must do a much better job of demonstrating how prevention can help healthcare achieve cost reduction and improve efficiency. I'm Dr. Weafe, and thank you for watching.